Hey there, this is Dr. Linda Burke. I am a board-certified OB-GYN physician, author of The Smart Mother's Guide to a Better Pregnancy, which is a prenatal book, and blogger of with the same title, The Smart Mother's Guide. Today I want to talk to you. I'm always talking about pregnancy-related issues, and today is no exception. I want to talk to you about an article that was published in USA Today on July 27th. The reporter's name was Allison Young, and the title of the article was called Deadly Deliveries. Title basically reflects the issues that are going on in terms of the United States having the highest rate of pregnant women who die in, quote, developed countries. According to the article, Canada has the lowest rate of maternal mortality, and our country, the United States, has the highest rate. This article is published, it's posted on my Facebook page, which is Dr. Linda Online, also under the name of The Smart Mother's Guide, but that is not why I'm having this video today. That's not why I'm talking to you, because I don't want to talk about the problem. I want to talk about the solution. I want to talk about solutions that can reduce the number of pregnant women who die, because that is my passion. I've been a board-certified physician for many years, been an OB-GYN for 30 years, and this is what I am trying to do, is reduce the number of bad things that happen to pregnant women. So, what I want pregnant women to do, what I recommend that you do is, number one, buy a blood pressure machine, because that will definitely help you know where you are in terms of the health of your cardiovascular system, and basically it's going to determine if your doctor might be missing something if you start to get high blood pressures and when you go to the office they're not high. Second thing I want you to do is understand that in that article they talked about the two main reasons that pregnant women die in the United States, and the two main reasons are hemorrhage and hypertension. And so my passion is trying to make sure that Pre-Eclampsia, which is a hypertensive related disorder, that Pre-Eclampsia is diagnosed accurately. So we were taught that the treatment for Pre-Eclampsia is it's a placenta problem, and that once the placenta is removed, once the baby's delivered and the placenta is removed, then everything is fine. We now know that Pre-Eclampsia has different categories, different subsets, and there is a subset of women who develop Pre-Eclampsia after having a baby and after having normal blood pressures throughout their pregnancy. Why does that happen? It happens because when you are pregnant and when you are in your third trimester, your body produces extra fluid in anticipation that you're going to lose a lot of fluid, specifically blood, when your baby is born. And physiologically, that is usually the case. However, for some women, by excreting that extra fluid, it sets off what's called a cascade effect, and it affects certain things in your blood vessels, which then causes your blood pressure to rise. Remember that Pre-Eclampsia can occur up until 6 weeks after your baby is born, okay? And the thing that you really want to pay attention to after delivering a baby is headaches. That is a sign of hypertension, even when you are not pregnant, but especially after you've had a baby, and let's say your blood pressure has been normal. So if you have a headache after you have a baby, I want you to take your blood pressure. If that headache is not resolved with over-the-counter medication like Tylenol or Advil, I want you to call your healthcare provider. If he or she doesn't ask you to come into their office to be further evaluated. Again, I want you to take your blood pressure. If that bottom number, which is called the diastolic reading, if that bottom number is 90 or greater, I want you to take a picture, pull out your camera phone and take a picture of the blood pressure reading, and I want you to take that picture, which is called objective evidence, to the emergency room. When you get to the emergency room, I want you to respectfully ask to be monitored, to be seen by an obstetrician. Many hospitals now have what's called, these are full-time physicians that work in a hospital. They're called hospitalists, and hopefully you will go to a hospital that has an OB hospitalist. The ER doctors are trained to evaluate emergency conditions. But in a pregnant woman, an emergency condition could be very, very different. Sometimes when you present with a headache, they will give you pain medication, your blood pressure will go down, they'll send you to the radiology department, do a CT scan. The CT scan doesn't show any active bleeding, and so with your blood pressure lowered, they'll send you home, only for you to return later on with an elevated blood pressure because the pain medicine has worn off, and potentially all kinds of problems, which includes potentially a stroke. So the way you avoid that issue is to be evaluated by an obstetrician who will activate the protocols that are necessary to determine if you have preeclampsia or not. If you have preeclampsia, you will receive IV antihypertensive medication that will lower your blood pressure in addition to magnesium sulfate. If you do not have preeclampsia, they will have done the proper evaluation, and then you will be sent home. So I hope I haven't worn you out with all of this information, but I think it's extremely important. I am a firm believer in empowering patients, and I believe that the more information you have, the more you know, the better you can help yourself and also help the healthcare system to navigate your care so that no one makes any mistakes. In closing, I respectfully ask that you please share this video, because in doing so, you might not just share information, but you might also save a mother's life. I'm going to be doing these videos on a weekly basis. Also going to be sharing some very exciting news in the future in terms of things that I'm developing and free things that I'm going to be offering to pregnant women. So thank you so much for listening, and I will see you next time.